who have joined us, and this will be a 4-hour meeting, and we have many guests in this session also, and I think this will be a very, very good uh, meeting, and there are all the pioneer speakers in this session, like Dr. Akasaka, Dr. Jiad Ali, Dr. Gary Minch, and Dr. Ashok Sheikh from our country. And it will be followed by Excel trial by Dr. Greg Stone, and then there is a, because he has been kind enough to join because he had some problems, so he has just taken this particular time because and he will be telling on the update of Excel trial. And then there is a physiology session on FFR. Dr. Anil Dhal, Dr. Niels Johnson, Dr. Subhash Banerjee from Dallas. He rang me this morning that there is tremendous winter storm over there, so the electricity situation is precarious, and he may join in iPhone. Anyhow, Subhash is a very good friend of ours, and he must be joining. And Y. Chandrasekhar from New York, he will be joining. He is the editor-in-chief of Jack Imaging. And this session will be chaired by Dr. M.S. Hiramat, Dr. Keshava Murthy. Keshav, you are there? Dr. Balbir Singh, Dr. Devabrata Rai, Dr. Robin Chakraborty, Dr. P.K. Mohanan, Dr. Ronnie Matthew, Dr. Sadanand Sethi, and Dr. Rakesh Jadhav. So I would invite the chairpersons to take their positions, and I hope that this will again be a very successful session by participation of all our faculties, national and international. And now I would invite our very senior mentor and pioneer in Cardiological Society of India, Dr. Pradeep Kumar Dev, to inaugurate the session and to talk a few words regarding the NIC CSI and the CSI as a whole. So I would refer to Raghu to arrange for the inauguration ceremony, and then you please, Dr. Dev,
Okay,
you
sir.
please start your lecture.
Okay, sir.
Thank you very much, Dr. Kahali, for your kind words. Dear friends, I hereby declare that the webinar is now officially inaugurated and will continue to proceed accordingly as per the scientific program. This webinar is a part of CSI NIC educational initiative. Why CSI NIC educational initiative? Because due to COVID-19 pandemic, the routine regular conferences, webinar conferences and seminars were not being conducted. So we had to go for some alternative. So alternative is either webinar or some virtual conferences, because this is mostly because of social distancing, to maintain social distancing of 2 meters or so. So NIC has got two parts, coronary and non-coronary. The chairman of coronary segment is Dr. Dhiman Kahali, and chairman of non-coronary segment is Dr. D.P. Sinha. But Dhiman Kahali is the course director and moderator of this webinar today. The name of the webinar today is very interesting and very catchy. This is Cocktail and Dream. Cocktail means cocktail between coronary imaging and physiology, and dream means the future dreams for shaping and reshaping the coronary interventional, coronary and non-coronary cardiac interventional procedures, so that we can interact, we can innovate, we can exchange our ideas with our fellows in India and overseas. So, and the delegates are very, very giants. The overseas delegates are Greg Stone, Akasaka, Gary Meads, Niels Johnson, Elvin Kethi, Ziad Ali, Subhash Banerjee, Y. Chandrasekhar, Ramesh Daggubeti. There are Indian participants like P.P. Mohanan, president of CSI, D.P. Sinha, the chairman of non-coronary intervention, M.K. Das, immediate past president of CSI, Devabrata Rai, the general secretary of CSI. Other Indian dons are Ashok Sheth, Parveen Chandra, M.S. Hiramat, Dayanand Sethi, Shiva Kumar, H.K. Bali, Balbir Singh, Balbir Singh, Rakesh Yadav, Ravin Chakraborty, Anil Dhal, Sripal, Keshav Murthy, P.K. Sahu, P.K. Goel, Ronnie Matthew. I might have missed a few names. Sorry for that. Sorry for that. And for next 4 hours or so, we'll be watching and listening to performances of superstars of of our own country and abroad. And I believe this will be up to our expectations. I agree that these webinars and virtual conferences most of the time do not meet our expectations because there is no eye-to-eye contact and we can't see the body language of the speaker or body language of the audience. But still, if the content is excellent and the lectures are loaded with knowledge materials, then in fact it hardly matters whether it is a true conference or a virtual conference, whether it is a true seminar or a virtual seminar. So and and so last year we had to go for the virtual seminar because we could not maintain the social distancing of 2 meters and arrange a true seminar at the same time. And this year also there will be very soon. It is in the pipeline. The next NIC meet in Chennai, but we don't know yet as of now whether it will be a true conference or a virtual conference or a hybrid one. But we believe that the way the COVID-19 is decreasing in India, we may go for a true conference, but otherwise we'll have to be satisfied with the virtual conference only. Or at best it may be a hybrid one, but I think in a hybrid conference there are very few attendance, so I think it will be virtual conference will be better one. In the coming months of this year, we will come across similar webinars or virtual conferences which will storm our brain and satisfy our appetite for knowledge. Our chairman of NIC, Dr. Dhiman Kahali, is not sitting idle. He is taking every opportunity to overcome the hindrances brought forward by the COVID-19, and he has practically overcome those loopholes, and he's arranging these seminars like this, and we'll be arranging seminars like this, similar to the cocktail and dreams, and we are waiting for future cocktails and future dreams. Thank you very much, Dr. Dhiman Kali, chairman of the National Intervention Council. Thank you very much. I wish your
Thank
webinar
you, Dr. Dev. Thanks, Dr. Dev, for your excellent lecture. And you are really our mentor and pioneer. So thank you very, very much for the kind introduction. Now, I would request our chairpersons for this session, Dr. Hiremant, Dr. Keshav Murthy, Dr. Balbir Singh, Dr. Debabrata Rai, Dr. Ravin Chakraborty, Ronnie Matthew to take up the session and call the, and Dr. Ramesh Dagubati, have you joined, Ramesh? He's from New York. I don't know whether he's getting, because there is too much of winter and all these things. And Dr. Subhash Banerjee, Subhash, you can join from your iPhone. Dr. Mohanan, P.K. Mohanan, our president of Cardiological Society of India, Dr. Rakesh Yadav and Dr. Sadanand Shetty. So I would ask our first speaker, Dr. Ziad Ali, to start his deliberation. He is a master. I don't have to give introduction of Dr. Ziad Ali. He is based in USA and he is from this part of the continent and he is a master of masters and he will be talking on advanced OCT imaging guided intracoronary calcium management. So Dr. Ziad Ali, please.
Sir, this is from the back end again. Two speakers, Dr. Ziad Ali and Dr. Gary Mintz, have not yet joined, but we have Dr. Akasaka and Dr. Ashok Seth of the same session currently available.
Okay. So I greet Dr. Ashok Seth also. I can't see you, Ashok. So thank you very much for joining the meeting. So when they're late, I would ask Dr. Akasaka to start his lecture on how to image non-culprit lesions optimally by OCT in PPCI setting.
Okay.
So Dr. Akasaka, please.
Okay. Yeah. Hello, everyone. It is my really great honor and pleasure to be invited this wonderful session. Right. So, can you see my slide?
Your slides are visible, sir.
Okay.
Yes, sir. We can see all the slides very well.
Okay. Thank you. So, My talk is how to image non-culprit lesion optimally with OCT in primary PCI setting, right? So this is my disclosure slide. So let's start the case. The patient is unstable condition, right? ACS. This is an ECG at the time of admission. 56 years old male. We cannot identify any ST elevation or negative T wave. So anyway, but the symptom is very typical. So our younger colleague did angiography at night. So they can identify some ulceration in the proximal LAD like this and like this. So by angiography, they saw this might be the culprit, and they cannot focus on CX, right? And they did an OCT, yeah, as usual. And this is an LAD OCT. You can identify very complex lesion. Here is some ulceration and very complex condition. And with angiography and OCT, they decided this might be the culprit. However, this is a CX. You can identify some ambiguous findings, right? Here again, there are some rupture with thrombus, small thrombus, but they missed these findings. Then they put a stent in the proximal LAD, but next morning I pointed out this might be the culprit in CX. Then 1 week later we did an OCT again, right? Then we clearly identify the plot rupture, the CX, right? This is the OCT image at the time of admission, and this is in 1 week after admission. So it is important to identify the thrombus at the culprit site to decide culprit or non-culprit. So this is an consensus agreement from ESC, right? How to treat, this is a treatment algorithm to guide the use of intravascular imaging. Anyway, patient come to the acute coronary syndrome, we do the angiography. But if the angiography demonstrates the obscure condition or a non-obstructive coronary artery disease, they highly recommend the intracoronary imaging. And if the culprit is a plaque event, they recommend the culprit PCI. But if there are no findings, we have to think about no culprit or a MINOCA or a SCAD or other special condition. Right, this is a recommendation for the culprit lesion. How to apply these recommendations to non-culprit lesion? There are only one interesting report at the time of this AHA 2020. So the patient decided the MINOCA, myocardial infarction with non-obstructive coronary artery disease by angiography. They did OCT and MRI, right? So the patient finally decided MINOCA by angiography. If they decide MINOCA, they did a 3-vessel OCT and cardiac MRI 1 week after PCI. And this is the findings. OCT, 3-vessel OCT was done 145 cases, and they found some abnormality, nearly half, right? Also, they did an MRI in 160 patients, and they identified infarction 33% and regional injury 21%. And this is a summary. If they do the OCT and MRI, more than 85% have some abnormality, right? So it is very important to do the imaging if the patient have no significant disease in non-culprit artery. It is important to do the